Hi, and welcome to our video. Today we'll cover primary survey in an emergency setting. But before we continue, don't forget to like and subscribe to our channel. Primary survey is the first stage in any first aid assessment. It is an initial assessment of the situation and the needs of the patient, and it will help you understand whether you can approach and start to attend to them without putting yourself or anyone else at risk. It is done in just seconds, and it is intended to help you quickly identify whether there is immediate threat to the patient's life and determine whether someone has any injuries or illnesses that could be life-threatening that need to be responded to immediately. Okay, but how exactly do you do this? Dr. ABCDE. It's quite simple. Starts with the assessment, which is danger, response, airway, breathing, circulation, disability, and examine or exposure or environment, whatever you find it easier to you. So let's say your patient is lying on the floor. Let's call him Bob. So how are you assessing him? So let's follow Dr. ABCDE. Danger is related to any existing danger before you approach the patient. This could be toxins, uneven ground, heavily circulated road, or even an overly attached dog. After checking for danger, we assess the patient's response. Check if they see you and acknowledge you, or if they are unaware of your presence. If unconscious, call their names if you know them, or simply pinch their shoulders and check if they continue are responsive. I must add though, please do not slap Bob. Then we check for airway. If someone's talking to you, chances are their airway is clear and maintained, but for an unconscious patient, it might not be the case. Open their mouth and check if there's any obstruction. This could be water, vomit, or even an object, mostly found in small children. If it's clear, perform an airway maneuver to open the airway. This could be a jaw thrust if there's any suspected trauma, or a head tilt chin lift, as you see in the image. Now we go for breathing. So how do you know they're breathing? Place your face closer to their mouth and nose while looking at the patient's chest and wait to feel a breath and chest rise. Check if there's any abnormal sounds like a wheeze or a gurgling. If the patient is not breathing, check pulse immediately, reaching circulation. If you can also check if the patients look cardiac, this means do they look pale and clammy at first glance? Remember, this assessment starts the moment you rest your eyes on the patient, so you will be able to see it immediately. If there is no breath, there is no pulse. So in this case, call for help. Call the emergency service and wait for their arrival. So while you wait for the emergency service, start chest compressions. CPR is essential, but not this one. For a good CPR, place the palm of your hand at the center of the chest. Place both hands on top and press down at the rhythm you see in the video. Be mindful not to do it too fast or too slow. So let's follow a step-by-step guide. So number 1, call emergency service. Number 2, check vital signs like breathing and pulse. Number 3, open the airway with a chin lift or jaw thrust. Now step 4, this step is the only one that you can skip in certain cases. If there is any suspicion of injection of harmful substances, please do not place your mouth near the patients, as it could be dangerous to you. Also, if there is any foaming around the mouth, vomit, or simply you don't want to do rescue breaths, you don't have to. You just follow number 5. Count 30 compressions and 2 rescue breaths if you want to do it. If not, continue CPR and only stop when checking the pulse. Also, check if anyone else can make the call while you do the CPR so you can focus on the CPR while someone else is on the phone. Check if there is anyone else that could swap with you every 2 minutes. A good chest compression will make you sweat and tire you very quickly, So to provide the best chance of the patient's survival, make sure to take breaks and let someone else perform. Also, in every swab, check if there's either pulse and breathing. If not, continue CPR until the paramedics arrive, reaching step number 6. This time, everything is fine and Bob is alive. He's probably just drunk. So if the patient is breathing and has a pulse, continue your assessment and check for disability. Are they able to move their limbs? Do they have a sudden impairment such as slurred speech or a lateral facial droop? Any fast symptoms? Check for their level of consciousness, AVPU. Are they alert, responsive to verbal stimuli, responsive to pain, or unresponsive? You can also use GCS, which is Glasgow Coma Scale. This gives you a score on the patient's state. And also, don't forget glucose. Whether the patient is diabetic or not, hypoglycemia can easily be responsive to someone to feel unwell and faint. So make sure to always check. Finally, examine, or exposure, or environment. This is the time you examine Bob. This is the part where, after you have ruled out any life-threatening conditions, you need to immediate medical intervention from you. You can start to examine the patient and take a history of what happened and what led to the situation he's on. Now you know what to do in a first aid emergency. I hope this video was helpful to you, and let me know in the comments what you think. Thank you for watching, and I'll see you in the next one. Bye!